2 of my video on anorexia nervosa, with which I would like to raise awareness of this condition for May being Mental Health Awareness Month. And in the second part, I want to discuss briefly about the causes, the etiology, and to mention something about the treatment. First, to discuss about the etiology. Perhaps a great part is the desire to be thin, but perhaps more than that, there is a real biological cause. And as I mentioned, perhaps genetics, which is also in the literature, plays a significant role. Another interesting fact is that certain single nucleotide polymorphisms of the oxytocin receptor gene are associated with anorexia nervosa, and therefore this could give clues to the etiology, and also it could lead to better treatments. We know that there are clinical trials with oxytocin in anorexia which have given mixed results. Perhaps one of the reasons is that only patients with this single nucleotide polymorphism will respond to the oxytocin therapy. Another cause, which I found very interesting, is an autoimmune-inflammatory pathogenesis, like we are learning that underlies many neuropsychiatric disorders. As it is known, anorexia nervosa has been related to OCD, and in the literature there are reports of children 11 to 15 years old who have developed anorexia after an infection with the group A beta-hemolytic streptococcus, the so-called Streptococcus pyogenes, which also cause PANDAS, the pediatric autoimmune neurological disorders associated with a streptococcal infection, and also they could cause the Sydenham chorea. And the PANDAS develop suddenly. They manifest with tics, OCD, separation anxiety, nighttime fears. And something very interesting is that I have had many infections with group A beta-hemolytic streptococcus as a child. Perhaps I have mentioned before. When I was about 3 to 4 years old, and as a result, I developed first acute glomerulonephritis and then chronic glomerulonephritis, which was treated for many years. And when I started as a volunteer for Professor Eric Hollander in the Spectrum Neuroscience and Treatment Institute, Ms. Kazara Ferretti asked me if I would like to write a grant with Dr. Hollander on detection of autoantibodies in PANDAS in children. And so I wrote about the pathogenesis, and we designed different tests in the laboratory how to measure autoantibodies. And I thought, why do some children, after a group A beta-hemolytic streptococcal infection, develop PANDAS? Why do some, like me, develop glomerulonephritis, or others will develop chorea? Apparently, some children also may develop anorexia nervosa. In such children, antibiotics have been effective. So this is something very interesting, that anorexia might have a real autoimmune-inflammatory biological cause. And how this may relate to, for example, to COVID-19, because if COVID-19 causes neuroinflammation and triggers an autoimmune disorder, perhaps in the long term it could also trigger any of these disorders. And to mention now currently what kind of treatments there are for anorexia nervosa, the most effective is psychotherapy. There are different types of psychotherapy. The cognitive behavioral therapy is very effective. Also family therapy, which in essence my parents were doing, to monitor the patient's food intake, and in more serious cases it is necessary to admit the patient to the hospital for refeeding. It is important to give vitamins, calcium, in some cases estrogens. Psychopharmacological treatments exist, but they haven't been very effective. Perhaps for the reason that anorexia is an autoimmune condition, and perhaps anti-inflammatory treatments will be more effective. So far, the selective serotonin reuptake inhibitor fluoxetine Prozac, which is effective for treatment of anxiety or depression, has been used, and also the atypical antipsychotic olanzapine, which has a side effect of causing weight gain, which might be beneficial in the thin patients with anorexia nervosa. So I hope that with this brief presentation I raised awareness about anorexia nervosa, discussed a little bit about its causes and pathways to develop new and effective treatments. Thank you.